we talk about digital health and consumer transformation health. We've been doing it for years. And so, beyond my Fitbit and, partaking in, my own healthcare, this was the first time that I've tried something that I think is like novel. And so it felt really good to get first party data or experience to be able to bring to our audience. And so I'm glad we did this.
Choices, new players, new models of care. Consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 428. Today we have the flavor of the week about Amazon Pharmacy's latest new features. How significant is their new caregiver feature, and they're making PillPack available to Medicare Part D members? And is anyone paying attention to these iterative updates from one of the biggest brands in the space? I'll talk about that. Then Zain and I review our experiences test driving the Reperio home health screening kit. We compare our notes from using the kit and discuss the benefits of being able to get results from the comfort of our homes within a matter of minutes. If you want to see my experience with the kit, be sure to check out our brand new YouTube channel where I walk through the process step by step. With that, it's time for the awesomeness, y'all. Are you ready? Let's go.
Flavor of the week.
Amazon Pharmacy just took two major steps towards owning the future of medication management, and they're coming for the friction points that legacy pharmacy players still fumble. With a bold 1-2 punch, they're making life easier for two massive high-need audiences, caregivers and Medicare Part D members. First up, a new caregiver feature gives customers the ability to securely invite a trusted person, such as a family member or close friend, to manage their medications on their behalf. This might sound like a small UX tweak, but it's a big deal when you consider that 53 million Americans are caregivers, many juggling full-time jobs and the burden of coordinating multiple prescriptions for aging parents. With this new function, caregivers can log in through their own Amazon accounts, receive secure access, and manage prescriptions 24/7, placing orders, coordinating refills, and ensuring deliveries arrive on time. Second, PillPack is now available to Medicare Part D members, unlocking access to more than 50 million Americans who take multiple medications daily. This is where Amazon's logistics muscle meets true consumer need. PillPack's model of pre-sorted packets labeled by date and time and delivered monthly erases the need for pill organizers or keeping track of 5 different bottles. Customers just tear off a packet and go. Combine that with 24/7 pharmacist access, coordinated refill schedules, and delivery notifications by text or email, and suddenly medication management looks less like a burden and more like a breeze. Words like seamless and reliable come to mind. And depending on the prescription and location, it can also be delivered same day and for free. Speaking of affordable, Amazon Pharmacy takes most insurance, including Medicare Part D and Medicaid in select states. Prime members also get deeper discounts via RX Pass and other savings programs, and PillPack is free to use for customers without hidden service fees. What's the consumer lens here? Amazon isn't trying to replicate the traditional pharmacy experience, they're redesigning it around the realities of modern life. This is about putting control in the hands of consumers and caregivers alike, with tools that are intuitive, on-demand, and built into platforms they already use. Whether you're a caregiver working late or a senior managing multiple meds, Amazon offers a simple message. You deserve a pharmacy that works for you, not the other way around. In a world where time, trust, and transparency are the new healthcare currency, Amazon Pharmacy is writing a new playbook. And with moves like these, they're not just playing, they're leading the way. Let's remember the importance of the medication management experience as we consider how to bring consumer-centered healthcare to ourselves and those whom we care about. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week. Shed is revolutionizing health and wellness by making wellness available to everyone. Through personalized nutrition, high-quality supplements, and science-backed wellness strategies, Shed empowers individuals to take control of their health and live longer, healthier lives. Not sure where to start? Try NAD+, the ultimate coenzyme that supports cells, DNA repair, and anti-aging. Or maybe you'll like LDN for managing chronic pain, autoimmune diseases, and metabolic health challenges. Visit Try Shed to start your wellness journey today. That's tryshed.com.
flow, the flow, the flow.
Hey, Zain, we're back in the saddle. How are things been?
Good, not bad.
So this is a different type of episode. This is the first of, I think, many, what we're referring to as test drives. And the plug here is that as we make the shift to include YouTube in our world here, that we're releasing video test drives of consumer health devices and at-home tests, as we'll hear about today from Reperio Health and their home health screening kit and our experiences there. But as much as we talk about things to kind of set up today's discussion, the reason why we felt compelled to do this is there are so many new things coming out. If you ask anyone on the street, if you ask people in healthcare, our normal listening audience, we might have heard the name, but we don't actually know what a device does or what a kit does, what the benefits are. So we are doing as much as we can to test drive a lot of these things. We'll be reporting back on our own experiences. I want to be better informed. I know you do too.
Absolutely.
And I would also say any users of any of these devices who you've had an experience with that you'd like to share, we'd love to feature you on here. And we're going to be trying to convene some panels or even just individuals to share your stories about your experience with these devices. So
I love
that's
it.
kind of the setup today. Let me dive into what Reperio Health is for a moment here, and then Zain, maybe you can guide us through some of the stages of what it was like. So we both received the Reperio Health home screening kit, and we'll walk through what our experience was. We each did it individually, so we'll kind of compare notes on that. Let me start with a little bit about them. So Reperio Health is, like I said, an at-home preventive care screening. One of the cool things is that you get instant results. So there are some basic things that you would normally have to go to the doctor and or lab to get to be screened for. And what it does is puts all those things together. You don't have to purchase them. They have the devices, you receive them, and then you use them, and then you send them back. So then they get sterilized and they're able to be reused. So honestly, kind of a genius, one of those things like, why didn't somebody think of this before kind of moment? I had kind of one of those moments. We had the opportunity to speak with their CEO, Travis Rush, at Vive. And that was one of my first thoughts. I'm like, why hasn't somebody thought about this? So some of the other thoughts or connections will be, how does it fit into someone else's healthcare journey of like, well, what if I am seeing the doctor for certain things? And what if I did just get my blood pressure measured or screened or whatever? How does this fit in? So I think we'll share some of those insights. But it is this idea of a kit that has basically a virtual consult, a virtual clinical grade consult, and the numbers that you can see instantly. Basically, by the time I took care of all the devices after using them and getting the screening done, setting them back in the container, my results were available. That was literally just a few minutes. So that part was interesting. And I think we'll talk some of the parts about the benefits and the process here. So again, it's pretty new on the market, but one of the cool things is that they did just announce, at least as of this recording, it was just a few days ago, they announced a $14 million funding round. So that funding is to bring their at-home preventive care solution to all 50 states. And kind of exciting news for that. We didn't know that was coming, but really, really happy to see that. So Zain, why don't you kick us off here? You want to talk about kind of either what the setup was or walk us through like your experience, and kind of I'll add as we go along.
Maybe one thing I'll just add just to give our listeners context. The use case here is that, Jared and I aren't necessarily the official use case. Travis Rush, their CEO, and we work with Kayla Weeks from their marketing team, were very kind in saying, hey, do you want to try this? And we're like, sure. But the way a patient would really experience this is Reperio Health would ultimately partner with your health plan or your provider and be able to offer this as a service. Unsure if there'd be a cost to the patient. I think they try not to, because in their vision, this would be like your annual wellness checkup that you elect to have sent to your home to be completed. So that's kind of the framework or the mindset that you should think about as we're going through the review. And so would love to maybe to approach this conversation, Jared, almost as if it was like a CPG product review you see on YouTube for maybe a watch or a pair of shoes, or you see those things on Instagram. So I think we should talk about the unboxing and first impressions, and then maybe talk about the digital experience a little bit, the sample collection process, which obviously is a big piece of this since there's a glucose and lipid panel that they're looking for. to collect. And then the shipping and turnaround, and then probably results in interpretation. And we'll just talk our way through it if that works.
Sounds great.
So maybe to get us started then, let's talk about the unboxing and first impressions. And so in my mind, the first impression, and this kind of connects with the digital experience, so we'll mix them a little bit. But, the moment we told Reperio Health that, hey, we're interested, they already had our email. So within an hour, I had an email from Reperio Health saying that my kit was on the way. And presumably this would happen to you too if you're a patient. And so you automatically get that email, a text message as well if they have your phone number, with the tracking coming through UPS. And so you know where your package is. And sure enough, when it arrives in a very, very solid, heavy cardboard box, fully branded with the Reperio Health branding all over it. And then the kit is actually inside. And so when you open it, there's another hard shell case that has all the tools in it branded again with the Reperio logo. Shipping labels to return it back are already included. And so you don't have to worry about shipping. Like truly, this box contains everything you need. It should not cost you an additional dollar or any more time than you'd expect to do the test and then get it back to them. And so the box in itself, when you open it, it contains a blood pressure cuff, the point-of-care lipid and glucose testing machine. It has the lancets, the pipettes, the bandages, the gauze, and the testing strips that you need to take your little blood sample. It has a Bluetooth scale in it as well. And then in the center, there's I don't know what to call it. I just call it like a Bluetooth brain that connects all the tools together so that it actually connects to the Reperio Health app, which again, you are reminded of through the emails and the text message you get. Not only is your package on the way, but in order to get the most out of the package, be sure to download the Reperio Health app so that you can start your annual wellness visit as soon as it arrives. And so in my mind, the unboxing and first impressions was pretty impressive. I took some pictures. I'll share it on my blog and make sure it gets over to the healthcare app as well. But I would say 10 out of 10 for packaging. Everything is in there. There's even a placemat so you don't have to dirty wherever your workspace is going to be. Everything you need to do what you need to do is there. What was your impression, Jared?
I agree. I just thought sleek product design from the get, and even not knowing, I tried not to actually research too much before just to get some genuine impressions of the unboxing. And I did think I was like, oh, of course that's in there. Once I was taking everything out of the packaging, it made a lot of sense. I'm like, okay, it didn't feel overwhelming, I guess was my thought. I wondered if I would feel overwhelmed with a lot of different things, and they were very just well packaged, I guess, so I didn't feel that way.
I think too, kudos to them too for correctly labeling everything. It's very easy in the kit to understand what everything is. And in a second, when we talk about the digital experience, we'll talk about the app and how it helps you follow you along. And so what I really appreciated is I try to put myself in the perspective of my grandmother, who has a number of chronic diseases, isn't a digital native. And I kept thinking to myself, could she use this? Is it simple enough? And so far, I would say yes. It's very intuitive, what you need to do, what you need to grab, what things are for, and maybe to jump into the digital experience. And so once this thing arrives at your door, you're prompted by, again, a text message and an email to download the app. And then it took me a few days before I had time to do it. So I kept getting messages from Reperio like, hey, you only have a few days left to get this done. I don't know if that was by their design or if that's how it would be for a normal patient. But what I thought was really interesting is the moment you download and log into the app, it's already, I guess, paired to your email. And so I didn't need to go through some complex sign up at all. A very simple email name. I don't even know if it asked for that. I already somehow knew my email. And then the app itself is pretty straightforward. And so it jumps you right into educating you on what is in this box, what is the function of every device and every vial, what should be in there. It automatically reminds you to don't discard the shipping labels because you're going to need them, so on and so forth. And what I loved about the interface is it walks you literally step by step. There was not one step they missed through the education. That's essentially like a little cartoon showing you what you need to do, how you need to get ready, and then ultimately walking you through your visit. And so I thought that was super impressive that Reperio team was able to create that, and truly step by step. There was nothing that I felt like was a gray area where I didn't know exactly what I should be doing. It walked me through the whole thing.
I agree. The simplicity of, it can't be overstated. We talk about digital user design, and the product design was so key here because, again, you're talking about things that people really really haven't done for themselves before. And those who probably will benefit from it the most might have the least experience doing anything like this on their own without any guidance. And so I was paying attention to that myself of like, same thing. Yeah. Could somebody else, how simple is this for anyone else in my household to do or whatever? So I agree. Those are all strengths.
It reminded me, like, not to necessarily put them in this category, but very similar to like how when you buy a new iPhone or Apple product, immediately you're launched into the setup function and it's super intuitive. It's like a simple screen, simple words, configure your Bluetooth or set up your clock or whatever, like very, very simple and straightforward, as if Apple was doing it. And so kudos to them.
Yeah. So then you got everything there. How did it work?
Jumping in then to like the sample collection. And so this made me most nervous. So the app walks you through like calculating your weight and your BMI, which the Bluetooth scale, I believe, if I remember, automatically connects to the app. So your weight gets entered. You are given like a little tape measure to measure your waist. I'll tell you what my numbers were to ultimately help figure out what your body fat and BMI is. And so you have to enter that in manually. But again, the instructions tell you exactly how to do it, like simple, simple, simple. But then the hard part, what I thought would be the hard part came, and the most nerve-wracking part is actually collecting the blood sample that you then use for your, was it lipid and glucose panel? And so I don't love blood and I don't like the idea of pricking myself. But again, right away, the education talks to you about how to prepare your finger. It comes with the alcohol swab. You wipe your finger, you press a little bit, and then you use the, what do they call it? Is it the pipette? No, the lancet to make a little poke in your finger. And it shows you exactly how much blood you need and then where you need to put it on the diagnostic machine. And so again, like super easy. It tells you the exact sequence into how you should pull out the lancet and set up the machine, set up the point of care machine so that it works with the 2 testing strips. And then automatically, once you do that, you just hit the start button. And what I appreciate, again, going to the details, is the interface that is on the testing machine. In the educational piece of the app, they duplicate it. So you can see exactly, match that, okay, I'm doing it right. I click this button. It'll then do this. It'll then do that. And before you know it, you have your results. And so again, you take your blood, you put it in the testing strip. And before you know it, within a couple of minutes, those results are then uploaded into the app. And so again, ultra simple. And then they even give you bandages too, so that in case you're bleeding after, it's all there.
Well, yeah, I'll pause on the part about drawing your own blood for a moment too, because out of the whole experience, that's the part I thought that's something to be aware of for those who are interested in doing it, but just might not have thought through that process, because I was one of those. I was like, yeah, I'm not sure the last time I drew my own blood for anything. So it is one thing like where you can just look away in the doctor's office. And for some reason, maybe after working for like orthopedic companies and stuff, I actually like looking at it while it's going on. So I didn't mind, but I could see that being an easy point to just be like, yeah, I'm out. Like, or I just don't want, can I just do the rest without that? And so it's good to know, like it's as simple as it can be. It's as painless as it can be, I thought, but I definitely remember thinking through that part of like, oh, like that's just good to be aware of that's part of this process.
Totally. Then I guess moving to the next step. So getting your blood test is sort of the last step in the Reperio process. And then immediately the app starts to prompt you, okay, it's time to repackage everything. It tells you what to throw out, what you need to send back. And again, step by step walks you through, here's how to repackage here's how to repackage things into the case, put it back into the box. And oh, by the way, we already sent the shipping labels. And they even go a next step further and say, click here to schedule your pickup. And so I remember when the box first came to me, I thought to myself, gosh, like, I'm first world lazy. Am I going to have to go to the UPS or FedEx and actually bring this in? No, like they will come and do a pickup. And so really appreciated that. And then want to draw out what you said earlier, because this is a point of care test, you're not sending samples of your blood anywhere. And so I know some people may not like that, could feel weird to send your blood in the mail, but you result right there, right? And so you already have your results, you throw everything away. All you're now doing is returning Reperio. It's equipment that belongs to them, and presumably they'll provision it and send it back out to the next worthy patient. And so really appreciated that there was a totally integrated process. So repackaged the box, and I live in a condo building. And so within the Reperio app, I just told them where to find it. And within 24 hours, UPS was at my place, picking up the box and taking it away back to Reperio. And so really, really, really slick when it comes to ensuring that this is the easiest it can possibly be for a patient. And frankly, if I'm Reperio and investing, I'm not sure what the cost of that kit would be. They better make it easy or else they're not going to get their kit back, right? And so really appreciated that on the shipping, and then call it the lab turnaround. There really is no lab turnaround because you're getting your results right there. But curious how things work for you.
So a couple of things that stood out for me. One was the simplicity of the animation, like the explainer videos for each piece. One of them I was really impressed with that I've actually used since then outside of the Reperio use case was they were pretty extensive videos of how to calm yourself down before you take your blood pressure. And for me, I may have thought about before, there are times when I've gone to the doctor and I'm speeding to get there. I don't want to be late. I kind of rush in and they're like, all right, very first thing, let's take your blood pressure. And they're like, wow, like, let's try it again in a few minutes. That's the closest to this that's happened. But with this screening, there were these videos that literally told you, like, let's count together, like, let's inhale, exhale for this many seconds and do an exercise for a couple of minutes, a breathing exercise, a simple one. And that actually had me, when I actually took my blood pressure again about 10 minutes later, it had dropped like almost 10 points on the systolic. Like, it dropped significantly. And I'm like, I think that does feel more, that's definitely more my normal, like my baseline. So it's one of those, it seems like they did think of a lot of things. They've clearly tested it a lot with a lot of different types of users to include things like that. And it was simple enough. So it's good to know that you're not self-guided. You are literally guided through the whole thing. You don't have to just figure any of it out. It's very detailed. And yeah, the same thing with the tape measure for your waist. I'm like, I don't know if I've ever done this, or maybe it's been a long time. So they've reduced a lot of friction. They've reduced a lot of possible pain points, I felt like, during it. So that was one that stood out. And then the other one was, you're right, the return process. I just thought that couldn't have been any easier to have the shipping labels on everything. So yeah, I think process-wise, that was great. So I think then you were going to dive into kind of like the digital, like what you see in the app, like kind of the digital experience. Like,
what I liked about the digital experience, particularly around the results, is that it's just so easy. Like, at the end of the day, what Reperio is capturing through their annual wellness visit, it's not like it's super complicated. It's not like it's a super complicated intervention. And so the results that it actually gives you, which we can talk about in a second, you can download in PDF, like, really is pretty straightforward, almost like what you would see on a fitness wearable. Like, you have your blood pressure, your heart rate, your BMI. I think they said give you relative fat mass, your total cholesterol, LDL, triglycerides, and then depending on how you answered the question, fasting or non-fasting glucose. And so it all comes out in a pretty simple grid. Are you in green, yellow, and red? I would say there's some areas where I was in yellow and red that I wasn't expecting. And so it could have been because I just came back from the gym after that and had eaten. So maybe I did it at the wrong time. And I don't know that I calmed myself as much as you did. But what I appreciated about kind of those results and interpretation is Reperio puts it in a very digestible format. If you have any questions about what the indicator actually is, you just click on it on the app and it takes you to a fuller description of what the measure is and what being in green means versus yellow versus red. And then what I appreciate about it too is you could easily just hit the icon and it will download it as a PDF. And so I actually uploaded my results to my chart and sent it to my primary care physician, who made a few comments about it. And frankly, was very positive about the report. So I appreciated that too. But presumably, if Reperio was partnered with your payer or your provider, some of that could be even more automated. But again, super just simple results and interpretation on the app that are actually shareable. I shared them with my mother too, who's a nurse. And so she had a few things to say about my results as well.
The best chief medical officer in our lives, is it not? That's awesome. I agree. Not knowing what to expect. Again, I kind of went in blinded on purpose just to try to see how much I could figure out on my own. I appreciated the simplicity of it. I appreciated this type of one-on-one, a data point that's from you in real time of how to be able to look at what it means in context. I enjoy educating myself that way. I'm sure that's not for everybody, but if this is ordered for you or you ordered it yourself and whatever the process is, I would think that's something that you look forward to, is seeing how that looks in the app. I'm looking at it right now. I mean, what's a good one? Your heart rate very clearly just shows you in your normal range. But then, like you said, you tap on it and it gives a grid of like, what's good, what's bad, what's below average, what's above average and whatnot. So I appreciated that.
Simple and intuitive. In my mind, again, back to what I was talking about my grandmother earlier, I think like this device could easily be used by someone who has a lower health literacy than we would, even people that are like less tech savvy than we are. even folks that might have some dexterity issues or movement issues, like it's really simple. And then especially if they had a companion that can help them, it's for sure they can get through it no problem. And so I see this as a great product and service for a widespread group of folks who could use it, not just younger tech savvy folks like we are.
Well, what I like is that we talk so much about preventive care. And again, depending on where the order to receive this kit comes from, you can make the case that this is a big advancement in preventive care because it's a narrow set of data points that you're going to receive, but they give you everything you need to understand it, to get what you need out of it, to know potentially what to do with that information, because that's where we get a lot of frustration and pain points in terms of preventive care because we don't know what to do with the data, or there's just so many steps. When you mentioned even the fact that, you measure yourself on the smart scale, you don't have to take that data, copy it anywhere else. It automatically got fed into the app. So those connections, they thought about a lot of reducing friction there. So I think those were all benefits there. I didn't really have many, things that were, like negatives or things to improve on. It had more to do with the fact of, like we were talking about, like the drawing your own blood, which again, it was the finger prick. Like it was about as simple as possible. I've literally never used like the lancet and like the pipette and all that to actually put it on the test strip and stuff. It was kind of cool. But that could be just one of the few points of like, just be aware that that's part of this. And the reason you need that is to get those readings, and you'll get them fast. You'll be okay.
If you're a diabetic and you've been calculating your glucose at home all these years, you're fine. Like it's exactly the same thing, right? So for that cohort, they're probably laughing at us listening to us who have never done something like that before. The other thing that I'm thinking about is I actually did my test on Sunday at around 3 p.m., which no doctor's office is open on a Sunday at 3 p.m. And so this kind of sort of gives you that freedom and flexibility. So it's hard enough for me to go in and get an appointment for my annual wellness visit because the times are so restricted or the access is so terrible. And so just having that window to do it whenever I had a minute to sit down and do it, it could have been at 3 a.m., right? No big deal. Like the doctor's office is open because in a sense, you're the doctor. And if you think about it, if you go to your annual wellness visit, beyond the physician being to examine you and touch you and talk to you, they're basically doing the same thing, like taking these diagnostics anyway. And so I see the Reperio kit as being just as valuable, so to speak, particularly now that primary care is so rushed anyway, right? Like you need to get you in and out in 10 minutes. Might as well do a Reperio kit from the safety and the comfort of your own home and on your own time.
I love that. Couldn't agree more. And especially for one of those pieces where you're just not like, I don't want to know why it takes so long to get into a normal appointment. Is it worth doing this? Yeah, it's always going to be worth doing it on your own time. I mean, something like this, especially, I don't know what the total time for you was like to do the whole thing. I felt like it was like less than 45 minutes. I don't know.
I think they tell you on the app it should take just over 35 minutes. I think I did it in like 20, but I could have slowed it down. I mean, I think you and I can move through some of these things pretty quickly. But again, if you're maybe older, a little bit more concerned about this, sure, it might take you a little bit more time. The other thing too, I'm just sitting here thinking, obviously in our day jobs, we serve hospital systems with big primary care networks. And I just remember being in the hospital system when it was the season of doing annual wellness visits. And at one point you need to do them because of your payer contracts. But on another end, it clogs up a lot of access, right? That you're essentially bringing all these pretty healthy people through an annual wellness visit. So imagine the strategy of maybe being able to work with Reperio or a competitor of Reperio to offer that right segment of your primary care panel to just do this. Like, hey, we don't need to see you in person. And it frees up those appointments for primary care to deal with folks that are maybe polychronic or more acute, a more serious issue that a Reperio kit is not enough for. So I'm just trying to think of like how, your comment just made me think about how you might actually use this in practice to drive an access strategy, believe it or not.
I agree. It's a factor that can change that conversation.
For me, I'm relatively healthy. If we think of an in-person primary care visit as being sacred and scarce, should I really be the one going in if there's other people who could get a better return on their time with the physician? Probably not. And so if the Reperio kit satisfies, what I need it for, then good. And give the visit to someone who is more acute or like really needs to see the physician.
I love it. Well, what if we summarize here and kind of give it a letter grade here? Maybe it's just because graduations have just passed. So I'm thinking grades and things for my kids and stuff. But
yeah.
I think I'd give it an A minus. And the only reason I wouldn't give it a full A is because I feel like something would have to be like absolutely perfect. And that I think the experience itself was very close to perfect. The minus maybe just for the fact of like, there's still a bit of education that probably has to take place for this to scale and for everyone to realize the full value of it, which I do think will come with time. So again, the experience itself, I would give it an A, just the overall ability for it to make the difference you were just talking about. And I'd maybe settle it just at that A minus, but overall, very good. All right, well, we're setting the bar high then if this is our first one.
Maybe we can recalibrate after a few.
That's fair. We can do that too. But yeah, again, I think we were trying to be as fair and balanced as possible and did our best on that. So very cool. All right, well, let's do more of these. Let's do what we can. I think it was very telling about what this whole thing was like. And again, for any of our listening audience, if you are working with one of these device companies or anything, I'd say at home, any consumer health devices at all that you'd love for us to test drive, actually reach out. We'd love to try that out as well. So final thoughts?
Final thoughts. I would just say it felt really good because we talk about digital health and consumer transformation in health. We've been doing it for years. And so beyond my Fitbit and partaking in my own healthcare, this was the first time that I've tried something that I think is like novel. And so it felt really good to get like first party data or experience to be able to bring to our audience. And so I'm glad we did this.
Very glad too. On that note, we'll wrap there. Thanks again. And we'll see what the next one brings. But thanks for making this happen, Zain. And I'm glad we could talk about it.
Hey, appreciate the forum.